We want to be able to offer our patients the most advanced and most effective treatments for their situations. Many treatments are on the forefront of science.
Every week we have a meeting that we call Tumor Board to discuss what is the best treatment option for our patients, and it is really a tailored approach to planning a treatment for that specific patient with the cancer diagnosis.
I think what is most comprehensive and most revolutionary right now is that we are doing a molecular cancer conference. Very few places in the world, let alone the US, have this.
Outside of seeing patients, our tumor conference is one of our most important meetings because it allows us to take a step back and really come together as a team and discuss our patients.
Our cancer conferences are very unique and they're very effective. We have multidisciplinary teams coming. We have specialists, we have our pathologists, we have our radiation oncology department, medical oncology, genetics, our cancer navigator, and also radiology.
Well, clinical trials are a centerpiece to any good oncology program. It's really trying to bring in cutting edge to standard of care. Clinical trials allow us to utilize technology before it becomes FDA approved, before it's hitting the market on a broader scope. So what that means for that patient is they're potentially getting something that they wouldn't otherwise earlier. And many times now, that makes the difference.
So in the current world, we do multiple genetic tests on most of our patients. Some testing involves assessing a patient to see if they were born with a gene that may have contributed to the cause of their cancer, or maybe something we can actually target in terms of treating their cancer. We also test the tumors for their genetics.
We have a dedicated geneticist, which very few cancer centers can provide, which helps not only for the patient but for all the family members. And we're finding out that cancer is very different in each individual, how it presents and how it behaves, and therefore a cancer should not be treated all with chemotherapy and all with radiation, but it should be individualized based on how that molecular signature works.
Genetic testing across the board is playing a role in making cancer care more personalized. The goal is to try to provide a more personalized assessment. It's also changing the landscape of how we are more proactive and more preventive in trying to catch cancers earlier or potentially even trying to prevent cancer from happening.
And every day treatment is evolving and we want to be on the cutting edge.